The new coronavirus has brought people life to a near standstill, closing businesses, canceling large gatherings, and keeping people at home. In states and cities across the world, government officials have ordered residents to stay home, shelter in place, and otherwise put their familiar routines on pause to help quell the spread of COVID-19. To adhere to these executive orders means staying home from work and school for weeks on end, only mingling with members of your own household, avoiding visits with family and friends, and maintaining at least 6 feet of space between yourself and the next person in line at the grocery store. As the streets empty and people grow increasingly homebound, one big question keeps cropping up. When will things return to normal? The real answer is that no one knows yet. Near the end of World War I, a nasty flu started spreading around the world. The virus responsible for the disease, which became known as Spanish flu, infected over a quarter of the world's population. With an estimated death toll of between 50 million and 100 million, it was one of the deadliest pandemics in human history. In the midst of this pandemic, during September 1918, cities around the U.S. were planning parades to promote Liberty Bonds, being sold to help pay for the war effort in Europe. In Philadelphia, Pennsylvania, where 600 soldiers were already infected with the flu virus, city chiefs decided to go ahead with their parade. Meanwhile, the city of St. Louis, Missouri, opted to cancel their parade and introduce other measures to limit public gatherings. 1 month later, more than 10,000 people in Philadelphia had died of Spanish flu, while the number of fatalities in St. Louis stayed below 700. The parade was not the only reason for the difference in death rates, but the figures show the importance of measures now known as social distancing can have during pandemics. Social distancing refers to a way of creating a barrier of physical distance between two or more people so that transmission of virus can be prevented or halted, says Arindam Basu, Associate Professor of Epidemiology and Environmental Health at the University of Canterbury, in New Zealand. One analysis of the interventions made in several cities around the U.S. during 1918 showed that those that banned public gatherings, closed theaters, schools and churches early had far lower peak death rates. Just over 100 years later, the world is facing another pandemic, this time from a different virus, the COVID-19 coronavirus. Today the global population stands 6 billion higher than it did in 1918. While COVID-19 is different in many ways from the Spanish flu, particularly in terms of who it affects and its mortality rate so far, there is a very important lesson about the difference social distancing can make. It might still be one of the best ways of fighting this pandemic. At this time, we do not know of a safe and effective vaccine, nor do we know if a safe and effective drug will work to eliminate the COVID-19 infection once it has occurred, says Basu. In the absence of these, our best bet is based on prevention. Many countries around the world are now experiencing different measures in an attempt to enforce social distancing to slow the spread of COVID-19. They range from ending mass gatherings, closing public spaces like leisure centers, pubs and clubs, to closing schools and in some places a total lockdown with people forced to stay indoors. While self-isolation is a form of social distancing, there is an important distinction to be made. Self-isolation and quarantine are aimed at preventing people who are infected or are known to have had contact with people who are infected from passing on the virus. Social distancing is a wider measure aimed at stopping the kind of mixing of people that allows infections to spread through a population. And we may need to keep our distance from others for some time to come. New computer modeling research from Harvard University, which has yet to be published in an academic journal, warns that it may be necessary for intermittent social distancing measures to be maintained into 2022 in the U.S. unless other interventions such as vaccines, drug therapies and aggressive quarantine measures can be put into place. This is because while a one-off period of social distancing might delay the peak of the outbreak until later this year, there is likely to be a resurgence in cases towards the end of the year if the virus shows some seasonal variation. But there is a good reason why social distancing has become such an important strategy in controlling the COVID-19 pandemic. Each person infected with the COVID-19 coronavirus is thought to pass it on to an average of 2 to 3 other people in the early stages of an outbreak. The time between infection and symptoms appearing has been found to be around 5 days for COVID-19, although it can take up to 14 days for symptoms to appear, according to research in China. If you are infected and continue to socialize as normal, it is likely you will pass the virus on to between 2 and 3 friends or family members, who could each then go on to infect a further 2 to 3 people. Within 1 month, one case can lead to 244 other cases in this way, and in 2 months, this soars to 59,604. There is already some evidence that staying at home, and maintaining a safe distance from others, can slow the spread and stop this domino effect. Research looking at infections in Wuhan showed that the introduction of large-scale control measures saw the reproduction number in the city fall from 2.35 to almost 1. When a reproduction number reaches 1, the number of cases will stop rising as effectively each infected person is passing it on to just one other person. Modeling work in China has shown that substantial levels of social distancing was key to reducing this reproduction number in Wuhan and the wider Hubei region. It concluded that the earlier a lockdown is put in place in the epicenter of an outbreak, the smaller it ends up being. One of the main aims of social distancing is to flatten the curve, which means delaying the spread of the virus so it reaches people more slowly. The idea is to lengthen the time period over which the virus travels through a population and push the peak number of cases back so it appears later. A graph showing the number of infections would peak much more quickly without social distancing. With it, the curve is much flatter, meaning at any given time the number of infected people, and therefore people needing urgent care and resources, is lower.